Hi guys, Dr. Shaun here. Hope everyone's doing great. Well, we actually received a question from one of you guys about, this is what she said. She said, I'm worried about developing a whistle when I talk from dental work. How can I prevent that? Okay, well that's a great question. So in regards to dental work, whenever the front teeth are worked on, whether it be bondings, crowns, veneers, and so forth, there's always a chance that certain sounds can be affected. This is because the way our teeth contact each other or how they are shaped can affect the sounds we make, especially the S sound, the S. So when our top and bottom teeth, like the distance between our top and bottom incisal edges of our teeth, that can affect the way we make the S sound. So the top and bottom incisal edges of the teeth have to be a certain distance apart, or else there could be a whistle sound when the patient tries to make an S sound. This is called a sibilant sound, and it is made when air is forced through the teeth's biting edges. The patients that have an issue with this mostly are denture patients, but it can happen on any sort of dental work. Now, to prevent the development of whistle sounds, I recommend that the patient make sure that there's nothing placed permanently until the restorations are fixed. So, for example, if the patient's getting dentures, the dentist can actually position the teeth in the correct position. So the dentist can actually move the teeth in the wax until they're at a position where the patient's not being affected when they have those S sounds. For bondings, the dentist can actually add or take away bonding material to get the teeth incisal edges to the correct position. So for example, if they're too far apart, they can add some bonding to the incisal. If it's touching too much or too close together, they can remove some bonding by just polishing it away. Now for veneers and crowns, I always recommend you have the dentist do a wax up. And then from that wax up, temporaries can be based on that. And then we can try the temporaries in the patient's mouth and have them try to speak. If there's an issue with their S sounds, we can go ahead and add temporary material or composite material to those temporaries to get it to the correct position. Then after that, we can actually take an impression of those temporaries and send it to the lab so they can fabricate any restorations from those exact impressions of their patient's temporaries. So to this person who asked this question, I just want to say that you really have to communicate well to your dentist and just not to worry. As long as you do that, I'm positive you'll be able to prevent a whistle from developing, okay? Just make sure there's nothing permanent until everything is completely sounding normal, okay? Well, there you go. I love answering all your questions. So if you have any other questions, please don't hesitate to ask us. All right, have a great day, guys. Bye.